why acute rehab or LTAC may be dangerous for your ventilated mom in ICU and what to do instead. My name is Patrick Hutzel from intensivecarehotline.com, and this is another quick tip for families in intensive care. So today I have an email from a reader who says, "Hi Patrick, they're mentioning putting my 71-year-old mom in an acute care rehab. She had a spinal cord injury and is paralyzed from the chest down. She was intubated and had a tracheostomy. They're trying to wean her from the ventilator, but have only had 4 hours of success off the ventilator. One of your articles says a long-term acute care facility should be avoided. She has Medicare. The hospital says it will provide better rehab for her." So, if your 71-year-old mom is ventilated with a tracheostomy, paralyzed from the chest down due to a spinal cord injury, and they're trying to wean her from the ventilator but have only had 4 hours of success off the ventilator, you need to stop and take a deep breath before agreeing to any transfer. The hospital and the ICU is likely pushing for acute rehab or a long-term acute care facility, also known as LTAC, saying things like, "It's time to move on from ICU. Rehab will be better for her recovery. She's not, quote unquote, acute anymore." Let me tell you what they're not telling you. Why LTAC or acute rehab is dangerous. These facilities often have lower nurse to patient ratios, 1 nurse to 6 to 8 patients or more, and most of them are ventilated. Limited or no 24/7 respiratory therapy. Less specialized care for complex ICU patients. A quote unquote warehouse approach for ventilated patients. Your mom is still critically ill. She's not weaned off the ventilator yet. She's paralyzed and dependent. Moving her now could be a death sentence. Harsh, but real. Families call us all the time after a rushed LTAC transfer saying, "I wish we had never left ICU. Can you help me get my family member out of LTAC back to ICU?" Here is what you can do instead. If she's on Medicare, you have options. The best one is intensive care at home, and you can check out intensive care at home for more information. Yes, ICU level care, ventilator, tracheostomy, spinal cord injury, management at home with 1-to-1, critical care nurses trained in mechanical ventilation. It's much safer than LTAC, a much better quality of life, ongoing ventilator weaning in a real comfortable environment. If possible, you're back in control, not just watching her decline in a facility. Next, don't let them rush you. Push back, ask the hard questions. Does the rehab facility LTAC have 24/7 ICU trained staff? And you will find that the answer is no. Can they handle tracheostomy and ventilator emergencies? What's the nurse to patient ratio? Demand a family meeting. Put it on the agenda of the family meeting. Ask for a home care assessment from intensive care at home. Contact us before you agree to anything. And if you need help, we advocate for families like yours every day at intensivecarehotline.com and intensivecareathome.com. We help families avoid unsafe discharges and get proper care without compromising dignity, safety, or quality of life. We know how to navigate the system, negotiate with hospitals, and get your loved one the care they truly need and deserve.